cycles, they only last for 5 days. The bleeding isn't excessive. Yeah, and that she's going to continue the treatment path.
Excellent. So what about the line of treatment when any patient comes to you for gynecological disorders? So what will be your what will be your thought process? Some next one. This butterfly laptop. Butterfly laptop. What is the name?
Which one?
Butterfly laptop person. Yes, it's you. Please explain me the line of treatment when it comes to
Christina, and the line of treatment would be the Nabi Pichu, Kaki Pichu, or Ura Pichu. And the Urarashti Snehan.
It should be that we should think about, first of all, its Kshetra. The Kshetra is Apan Vayu, right? So according to Apan Vayu, there should be treatment. That is Uddar Pradeshi, Snehan Svedan. Then, continue please. I already spoken a lot. Yeah.
The Nabi Pichu?
Yes.
The Kaki Pichu and the Gura Pichu?
Yes.
The Mantra.
Next.
The Mantra Basti?
Excellent.
30 milligrams gradually increase the dose? You can start with 30 milligrams and then you gradually increase the dose as needed.
Very good. Yes, excellent.
And that's
it? Which medicine you can choose when it comes to gynecological disorder blindly?
The Basti treatment.
Yes, Basti treatment.
That Mandram Thailand, we're going to use that for gynecological issues, all gynecological issues.
Why? Which word is there in Dhanvantaram Thailam?
The Dhanvantari?
No, it's a Yoni Roga Kshayapaham. Yes, definitely. It's a Dhanvantaram, means it is very useful, but definitely we can use the Yoni Roga Kshayapaham.
Yes.
Please speak with me. I want that you should be familiar with Ayurveda terminology, Sanskrit terminology. Please speak with me. Yoni Roga, all of you. Yoni Roga Shayapaham. Shayapaham. Yes, so whenever the gynecological cases comes to your clinic, then your mindset should be towards the Dhanvantaram Thailam, and you will have that word in mind, that is Yoni Roga Kshayapaham. Yes, so I think so. I am clearly tried my level best to explain the first case, that is our gynecological case of Kashtartava. What it is?
Kashtartava.
Yes, any questions to anyone?
You guys know any other verbs to learn? Are there any other herbs besides Lodra that you can use for this patient? What would be the doses?
Yes, very good question. So other than Lodra, what other medicines we can use? So we can use Shatavari, because Shatavari is also excellent in gynecological disorders. So we can use Shatavari, we can use Sariva, we can use Dashamul.
Ashoka?
Definitely, we can use Ashoka as well, but it is not that Rakta Stambhak. Here, what we are looking for, the Stambhan medicine. So, for the Stambhan, Lodra is very good.
I have a question.
Yes, please.
I have a question for you. At
Yes.
least in Dr. J's class, Ashoka, we always correlated to stopping excessive bleeding. So if it's not stamina, so what action does it do? Maybe Garbhashya Shodhana. Garbhashya Shodhana Shoka. Okay. Dr. Judy, I have a question. So for this patient, you have only used Basti and Pichu and Lodra.
Yes.
So Lodra you gave us a Shirapaka or a Lodra a decoction? How did you administer Lodra?
Yes, very good question. This is all I expected. Means you are hearing my lecture with full, concentration. I'm so happy and I'm so glad. So, what should be the dose of Lodra? So, generally, when if there is a heavy menstrual bleeding, then the patient is bleeding continuously. If it is continuously, then our dose should be muhur. It should be continuously. We should give it like medicated water. We can give the Lodra medicated water if it is palatable for the patient. How we can make the Lodra medicated water? So just 1/4 spoon of the Lodra churna, half liter of the normal water, because Shita Jal is best anupan. It is mentioned in Ashtanga Hridaya. Though everyone is nowadays talking about Ushna Jal, but in our Sahita, Shita Jal, that is normal room temperature water, is best for our body. So we can use Shita Jal as an anuman. Then there is, we can use Tandulodak, means the rice, the raw rice, which are just 2 to 3 pinch, and we can put it in the water. We can crush it and we can make that Tandulodak, means rice water. Draw rice with the Sheetal Jal, and we can give it to the patient. With that, we can give this Lodra Churna. And when there is the symptoms which are continuously occurring in the patient, like Shwasa, Kasa, Hikka, all these things, then the medicine should be given muhur. So best thing, what practically, like I have spoken about the Pichu, in same way we can actually use the Lodra Churnam medicated water, because it is very feasible. And medicated water is mentioned first in where? Can you please tell me, any one of you? It is mentioned in Jwara Chikitsa, that is Shadanga Paniya. And once you understand the Jwara Chikitsa, you can treat all the diseases as per Ayurveda. So the same principle we can apply everywhere. So generally when you give, plus our body is made up of more than 75% of the water. So our water should always be whenever the patient comes to us, our treatment should start with the Panchabhautik Tattva. So first thing should come to our mind, that is water. So the water should be medicated water. So the Lodra Churna we can give as medicated water. We can give muhur, that is 2 to 3 pinch every 2 hourly, 3 hourly, as per the convenience of the patient. Else we can give it with the Tandulodak. That is Tandulodak is, I have explained you, that is 2 to 3 pinch of raw rice. It should be put in the bowl full of water, and you just crush it, and immediately you can drink it. There is no need to soak the water and all. So with Tandulodak also you can give the Lodra Churna. But whenever the cases like this come to our clinic, we should always think that we should give first of all the medicated water, because in Jwara Adhyay Shadanga Paniya is explained. So yes.
Exactly for this patient, 2 to 3 pinch. Like, how did you recommend it? You make this Tandulodak, you add it 2 to 3 pinch, and then every 2 hours, how many chicks are we recommending?
I want answer of this from this cute girl behind the blue t-shirt who is yawning.
Oh. Here's the question.
Yes. So, how we can give the Lodra Churna?
How is Lodra Churna given?
What is your good name?
Lorraine.
Laurel. Yes. Hi, Laurel.
Hello.
Yeah.
I like it.
So we can give Lodra Churna sublingually, because it is when we are giving 2 to 3 pinch, we can directly give it on the tongue and patient can have sips of water. Otherwise we can give it like 1/4 pinch 3 to 4 times in a day. Then definitely patient can mix it in the water, or patient can take it, patient can make it tablet form. We can make it in a tablet form and we can give to the patient, but it should be given muhurmuhu, that is continuously, as many as times possible, because there is a continuous bleeding.
Would Puranarva also be a good herb to get for them, or no?
What? Sorry, pardon?
Would Puranarva be a good herb also to prescribe to them? Punarnava is a good herb.
Punarnava will be a good choice, but definitely we need Rakta Stambhak medicine.
Okay.
Yeah, so Stambhanakar, any Stambhanakar medicine, and which will also give nourishment.
What was the exact proportion for the 1 liter of water? Like, was it a 1/4 of a teaspoon of Lodra?
It's just 1/4 spoon of Lodra Churna and 1/2 liter of the water.
1/4 teaspoon of Lodra Churna.
1/4 spoon means hardly, I can say 2 grams of the Lodra Churna and 5 liter of the water. That is generally we can give. Because 1 spoon is 5 grams, right? So if we are giving like 1/4, then hardly 2 grams. Because we are giving muhurmuhu. Otherwise we need, at least 1 spoon or something like that. But if you are giving muhurmuhu medicine, then doses of the medicine should be very in small quantity. And if you are giving churna in sublingual way, then it gives excellent result. I am talking in a very practical way, because in Ayurveda there is layer, all these forms of medicines are explained, right? Layer, payer, all these things are mentioned. So layer means when you give the medicine sublingually, that is directly on the tongue. Because many a times, if you know, then in sorbitrate, how they give it? Sublingually. When there is a very severe anxiety, there is medicine clonazepam, how they give it? Sublingually. So same thing is mentioned in Ayurveda, that is layer form. So you can give the medicine in layer form, that is a sublingual administration, and definitely you will get excellent results.
So she would drink only 1 liter a day, or she would have
No, you can make it again. Definitely you need continuous water. Like in India it is very hot many a times, like now there is a 43-degree temperature, so you need as many as, like, whenever, I don't suggest the patient, because our body is the best machine, so it can actually tell us when to drink water, what to drink the water, what to eat. So whenever she is thirsty, she can drink the water, but it should be a medicated water.
So what happened here is they replaced her table water with a medicated one.
Okay.
And because the main problem is a heavy bleeding, we have to use the stop the bleeding. For that, what is the treatment principle? We need to, in order to stop the bleeding, we are selecting the herb slow, which is, we have the quality, right? Sambana action, and which is also good for daily. And then another thing, bleeding, the movement, it's water, right? So we need to stop the water out, bring the water to the normal. So we use the blood. So very simple treatment. Only one herb of flow is what we use to slow down. And another therapy, Piju also done, and then the bus. So now the next question from you guys, how
you can use, sorry to interrupt madam, but definitely you can use this yukti in all the patient. Your water should always be medicated water, because it is mentioned in Jwara Chikitsa. So it is mentioned that whatever the principle mentioned in Jwara Chikitsa, it will be useful for other diseases as well. So whenever this sort of complicated patient comes to us, then we should always start our treatment with one drug, Ekal Dravya, plus the medicated water.
Patient needs breathing can be.
So in any condition, you can think about this thing as well. Definitely, you can give 2 times, 3 times, but you can think like this as well. This perspective of the treatment should be there in your mind.
I have 2 questions about the Bosties.
Yeah.
The first question is, after the bleeding stops, how often would we do the Bosty? Would it be every day? And also, I was wondering, do we ever do vaginal Bosties for disorders?
It is only Basti, Matra Basti, that too with Dhanvantaram Tailam, starting from 30, 40, 30, 40, and we have reached to 90. And previously I used to give it every day. Thereafter, when patient, started doing better, after a couple of weeks, I can say 3 weeks, I have started with, twice a week, then once in a week, then 15 days in a week, once in a 15 days, and now patient is coming like now and then.
Okay.
Yes. And it is possible when gynecological patient or this sort of complicated patient comes to you, then definitely somewhere we need to stop the treatment. There should not be dependency. And how Basti can give, excellent result. I will show one video on that as well, because patient has mentioned that it boosts the confidence of the patient, right? Have you heard that?
Yes.
Yes. So why it is? Because Basti works on your psychology as well.
Did you put the Sandhava in the Basti?
Already in the Hanvantaram Tailam there is a Saindhav, so no need to add the Saindhav. When there is no Saindhav, then definitely you should think about adding the Saindhav. When there are cancer patient, when there are autoimmune disease patient, that time you should think about adding the Saindhav. Here already Saindhav is there, because Saindhav can do Snehan Svedan.
Can you put the oil it's called Pichu, right? No, Pichu. Yeah. The Pichu on the yoni area too? Can you put it there on the...
Yes, we can give, definitely we can use Yoni Pichu, we can give Yoni Dhavan, Pit Panchavalkala and all. Means even Lodra Churna you can give Yoni Pichu. Definitely you can do all these things. But what happens now generally when we give oil for the, to keep it at vaginal level and all, many times it creates infection, because already the patient is having low immunity and all, it's continuously bleeding, there is already lot of moisture because of bleeding and all. So I have not mentioned Yoni Pichu, but many a times in like postmenopausal or, premenopausal, in these things, Pichu plays very important role. But in these cases where already moisture level are extreme, already the patient is need to use so many, sanitary napkins and all. So there, if I again ask the patient to keep oil and all, it is not convenient for the patient.
Okay.
Yeah, it is very practical to think like that, right? Any other questions?
You guys are confident to treat this similar type of case, huh? You cannot do what they hear. You know that. You can make it.
But when patient comes to you with so much of pain, please start with the very less quantity. Okay, you can directly jump to the Basti treatment, but always start with 20, 30, 40 like that. Okay.
How long did you drink the Lodra for? 2 years?
Anything else?
Yeah, how long she has taken
How long did she drink the medicated water? Like for how many days or weeks or months?
You can drink actually medicated water. Like many a times in this sort of cases, it is like feasible once the bleeding is stopped and everything. So it takes mainly 3 weeks or something like that. But after that, patient become used to, even many a times I give Jatamansi medicated water. It is to calm down the mind and everything. So patient asks for Jatamansi medicated water. You become used to, you just start. First you experiment on yourself. Then you will understand that how it actually makes a difference. Because our body is made up of maximum percentage of water. So when we have, as per our Prakriti or Rutu or some other disease condition, when we start with medicated water, we become used to for that. So definitely, like from my side, I just ask it for a couple of weeks itself. Once the patient is like doing okay, 60-70%, then I just ask that in like whenever it is possible, once in a day or like twice in a day, if you can drink, that is also okay. But patient become used to for that. Medicated water is a very good concept. And we should propagate it as an Ayurveda doctor, as an Ayurveda Vaidya, because it is nowhere. Still they are on sublingual and everything they come up with, but still medicated water is only present in Ayurveda. Pichu is present in Ayurveda. So we should highlight this. We have all this, strength. As in strength we have the uniqueness of Ayurveda. So please make sure that whatever the uniqueness we have, we should talk about that. We should implement in the patient, because patient has come up with the already all sort of medication and other stuff. So when patient come to us and when everything is, there is no hope, and if we are looking to give the result, then we should definitely think in some different way. We should not be like, whatever the simple, like we are just thinking in just, okay, this is there, this is that. No, we should always use yukti and yukti. And what is our uniqueness, that we should always keep in mind. So though it's any sort of disease, we are able to give the result.
Got a question from your side?
Hope this case is clear for you.
Yes.
How many of you have now confidence to treat gynecological cases? At least 30%, I cannot say 100%, but 30%.
Like 5%. Did I get that?
30% confidence to treat gynecological disorders.
Yes.
Clap for yourself. Come on, clap. Yes. Very good. I'm so happy. So should we start with next case?
Yes, please.
Hope it's very clear to you.
Yeah.
I'm able to give the justice to your time.
Yes.
No.
Yes. So should we start with another case?
Yeah.
Yeah. Thank you.